Good afternoon. We're going to start now. Next up, Fire Department. Commissioner, you can please proceed.
Thank you, and good afternoon, President Clark and members of City Council. I am Adam Teal, the Fire Commissioner for the City of Philadelphia. Joining me today are Deputy Commissioner Jesse Wilson and Chief of Staff Tara Moore. I am pleased to provide testimony on the Fire Department's Fiscal Year 2019 proposed operating budget. The proposed budget for fiscal year 2019 represents the most significant investment in decades for the PFD, with new resources for frontline staffing, training, health and safety, and equipment. The total proposed FY2019 budget for all funds is $287,192,921,000. And with that, I'm ready for questions.
Commissioner, you have broken the record for the shortest testimony. And I must say, we love it. Thank you so much. Commissioner, I want to ask you a question. I know your department receives a significant amount of grant funding, $20 million for FY19. Could possibly any of these funds possibly be threatened by budget proposals on a federal level in particular, or even state? But I know we get most of our grants from the federal government.
Yes, sir. We've actually been, and again, thanks to the team and many of the folks you see here, we've been fairly successful in the federal grants arena. Obviously, that's very uncertain right now. We do have a couple of applications in under the Assistance to Firefighters Grant Program. We also intend to apply for the Port Security Grant Program. We've been successful in all those grant opportunities in the past. At the same time, despite that amount of money, it still is marginal when you consider it against an entire $287 million budget. And frankly, I think some of the things we're really watching at the federal level are grant funds that go to other agencies, particularly out of HUD and CDBG funding, because that has such an impact on us in the fire department, EPA, on the built environment in which we work. So all of those federal funding streams can be impactful for us. Rest assured, we're going after every shred of grant funding that we can possibly find, including private foundations and other potential donors, within the strictures of city regulations. That said, I think it's always going to be marginal compared to our general fund commitment.
Let me ask you a question, because there's obviously a lot of discussion around the opioid crisis. Can you tell me how it's impacted your EMS response and the level of responses? Do we see a spike, or is it? Kind of talk to me about that.
Yes, sir. Well, it certainly is trending up, and I think we absolutely agree that it's a crisis. To put it in some context, last year, calendar year 2017, our firefighters, paramedics, fire service EMTs administered naloxone 5,005 times. And that certainly sounds like a lot until you consider that we responded to 296,844 total incidents. So those are EMS incidents, those are emergency medical services incidents of all types, heart attacks, trauma, illness. So, through that lens, obviously our mission is to serve all of those 297,000 patients. 5,005 received naloxone. I think from our perspective, though, one of the things about the opioid crisis is it is something we can sort of pinpoint and work together with a lot of partners. Anywhere that we can reduce our service demand, whether it's 5,000 runs or 1,000 runs, would be helpful for us. And of course, some of those cases can also put our responders in harm's way when they don't necessarily have to be.
Okay. All right, so I've been on this tangent about traffic, so I might as well ask you all. Traffic is challenging in the city of Philadelphia, a whole lot of places, particularly in the center city and some of the more congested areas. And I see it, I'm sure most people see it, where people, they see the EMS unit or the fire engine coming down the street and they hear it pretty loud, horns blow, the honk, and they just kind of like look at it, right? It's like, what do you think, this is TV? I mean, get out of the way. Can you talk to me about the challenges with the increased volume of traffic in the city and your ability to respond to 911 calls related?
Yes, sir. I certainly, it's a timely question. On my way in today, I actually ran across a motor vehicle accident. We were the first official fire department unit on the scene, and as we escorted the medic unit to the hospital, we noticed people do all kinds of things. It's really hard to predict what folks will do when they see the lights and hear the sirens behind them. The right thing to do is to move over to the right and stop. And of course, to do that with having some situational awareness around you of who's behind you, who's on either side, who's ahead, not just slam on your brakes. But that is the right thing to do, and what we're hoping people will do, if they move to the right and stop, that gives us a lot of options. But we really do need folks' help because traffic does negatively impact response times. And with what we do, every minute counts, and frankly, sometimes every second counts. So please, I appreciate the opportunity to say to folks who are watching, help us help you. Move to the right, stop until we can pass. And the same goes for our law enforcement brothers and sisters.
Right. Well, how can we help you? I mean, you see a lot of public service announcements about everything, primarily with respects to fire department. It's about smoke detectors. But, the inability to move through traffic can obviously, be the difference between somebody living and dying. So just talk about what you think we may be able to do, or anybody else, in terms of making people understand what, because I think the average person probably doesn't know what to do.
Right.
Because a lot of people, they just stop.
That's
right?
true.
Everybody stops, and it's like somebody has to do something. So
And
what would you suggest?
Well, one of the things we have here too in the city, especially in Center City, is this complex mix of pedestrian, bicycle, cars, and all other types of conveyances all going on at the same time. So I do think there are some great materials that are out there that have been released by a number of our professional associations, federal agencies that have the Move Over to the Right campaign. I think that's something certainly that we can look at, maybe with some of our partners getting on some billboards.
We the city.
Something we can do,
Yeah.
we the city, something we can do on social media is really highlight that, because I think there is an opportunity for education there.
Okay, all right. We'd be more than willing to work with you on that.
Thank you for asking the question, because it's a 24/7, 365 issue
Yeah,
for us.
I just see it. I'm like, my God, get out of the way, This issue about EMS incidents and citizens are, you respond, and there's a cost associated with, the EMS bill. Can you talk to me about, is there a cost to this average citizen when EMS has to come out for whatever reason? Can you talk to me about that whole structure as it relates to costs to the actual citizen?
There is a cost, and it essentially follows federal regulations. So we can't charge more than the federal regulations allow.
Okay.
And we also, the way we bill, so we bill something on the order of, I think right now it's around 240, 250 million. What we bill, not what we collect. I would suffice to say that we bill a lot more than we collect. And there are a number of reasons for that. One of those reasons is that we understand that folks, certainly on their worst day, we don't want to deter people from calling 911 when they need to. So we essentially recover costs when we can, or recover the cost of that particular service. What we collect, which is on the order of $41 million a year, is far less than it costs to actually deliver the service. But it is.
Do you have an internal entity that collects it, or is it the
We
Department
actually-
of
we
Revenue? We turn it over to the revenue guys, because they're pretty brutal. I mean,
We contract it out to a third-party vendor. It's one of the largest vendors in the U.S.
Okay.
They're actually a subsidiary. They're a kind of an EMS-focused subsidiary of a company whose name you would recognize, ADP. And they were recently sold. Actually, they were recently spun out to a different firm. So they have folks who are embedded with us to do the billing, and then they also have partnered with some firms here in Philadelphia to do some of their support and some of their back office work. They essentially do they follow protocols that we've established in terms of, I guess, what folks would typically call hard billing or soft billing. So we don't, they are not tenacious collectors. And I realize on the one hand, there's some opportunity there. On the other hand, our sense has been that folks, when they call for an ambulance, they need an ambulance, and they're probably not expecting a bill.
Right. So I guess a lot of people think I pay taxes and that should take care of it.
And it could, but right now it doesn't. Now those dollars accrue to the general fund. It's important to understand the fire department does not collect that roughly $41 million. That money goes into the general fund coffers, and then it's, but so, we are a general fund funded agency.
Right.
So at some point it does, at some level it does come back to us, just not directly.
So I don't want to belabor this, but there are people, we encourage people regardless of your financial situation to call, and people call, and a lot of people just aren't able. Is there a situation where the private entity attaches a lien, or they go a little further in terms of enforcing the collection of that bill? What actually happens if the person just can't pay?
I don't think so.
Is it a lien on their household, or
I don't think so.
do they have this civil penalty following them around,
No,
shows up on their
contractor
credit
doesn't go.
report?
But by virtue of the fact that we bill a lot more than we collect,
Right.
my sense is that, my understanding is that we're doing what some in the industry would call soft billing
Okay. All right.
versus hard billing, which is what you're describing.
Okay. Okay. Thank you. Thanks, Commissioner. Chair recognizes Councilman Dom.
Thank you, Council President. Good afternoon. And thank you for your service. I think you guys are doing a great job. So
Thank you, Councilman.
Thank you. I want to follow up on the Council President's question. It seems like the outstanding balance due is like $240 million or so. And we have a third party that's handling that collection. Do you think they're doing a good job? Because I noticed we paid them about $1.8 million in fees. Do you think they're doing a pretty good job?
Yeah. Councilman, I think that all depends on what one defines as a good job. They are certainly adhering to the contract, and I think, of course, for us, the policy challenge is exactly as we're talking about here, that
Right.
We certainly could ask that contractor to go deeper and do different things in the hopes of increasing our collection rate. Frankly, I'm not sanguine about whether those things would work, but that would be an option. I think that would certainly put us in a place where we would, we sort of consider ourselves a public good. Certainly for the firefighting and all hazards business, we're a public good. We collect something where we can to offset the EMS. If we were to do something different, I think that begs a larger policy question.
And but the other piece of this is like Medicare and in federal insurance programs, making sure that we collect 100% from the government on those programs of what's charged, not the people. Making sure the insurance companies and insurance are reimbursing us for what we're due.
And it's a great point, Councilman, and that is an opportunity, and we are leveraging those opportunities. Most of our collections are from third-party payers or from Medicare and Medicaid. We are doing some pilot programs with third-party payers and managed care organizations to see how we can, there's some win-win space there where we could proactively deliver care. They could save money. So we're trying to make sure when you see things like our alternative response units, those are the types of programs that we're hoping to start piloting so we can capture more of that with, for us, the happy consequences that it helps, again, marginally, but hopefully over time, helps reduce our service demand, because our service demand, you can see, just keeps going up, 300,000 incidents a year, and there's no end in sight.
From my little limited review of it, I think that's an area where we could really benefit, is on that third-party reimbursement, to make sure we collect 100% of what's due us.
We absolutely agree, and I think that's really where the kind of sweet spot is for us right now.
Okay, great. Another question I had is on page 4 of your budget, it shows the elimination of payments to other funds in the amount of $7,972,000. There was a payment to the water fund for usage of water. Is that what this is for?
Yes, sir. That is what's proposed.
So are we not collecting that or not charging that this year, or is that being waived?
Well, it has not yet been heard by the board, so we're not sure the outcome. I think that's happening on May 11th, May 10th or May 11th.
But that's not in your budget.
That's historically, that's been sort of it's been in our budget, but it's never really passed through the fire department.
Okay. Does that mean the fire department didn't pay it?
No, the fire department does pay it, has historically paid it.
But on the hand that you gave us, in 17 and 18, it shows paid, in 19, it shows zero.
I think that's what's proposed for FY19, is that payment would not be made.
Okay.
But that frankly is probably since it crosses agencies, that's probably a budget question.
Okay. I don't have any other questions. Thank you very much. Thank you, Mr.
Councilman.
President.
Thank you, Commissioner. Technology is an interesting thing, so as I'm talking to you, Bob here, he pulls up, it shows that Uber is actually replacing ambulances in a lot of hospital runs. Have you heard that?
I have. For us, that is not something that we can do right now due to state EMS regulations. And as you can imagine, it can be very challenging. Our dispatchers do an incredible job. It can be very challenging to triage a patient over the phone, but there are some innovative things that are happening. I was just in Washington, D.C. talking to the chief there. They're actually hiring nurse practitioners now to help triage those calls in their communications center, and in some cases actually direct the patient to a clinic or write them a prescription. They can do that, of course, because they have sort of a unique set of authorities. We are subject to state EMS regulations. We also keep in mind that we all of our EMS providers function under the license of an operational medical director who would have to be comfortable with that extension, because essentially they would be allowing that if it were, and you can envision if we triage somebody over the phone and said, well, you should take Uber, and they forgot to tell us about the large pulsating mass in their abdomen, hypothetically, and then what happens? But I do think, again, this is a lot of what we're talking about with these alternative response units, trying to look for a more proactive way to deliver care. There's nothing that says the fire department couldn't have a service like that, where we would say, okay, we'll triage your call, we'll send somebody out, but once they get there and get eyes on, or through telemedicine, which is another opportunity that technology might provide us in the future, and we're doing some pilots there, we could say, all right, we've seen you, but we don't necessarily need to have a medic unit come and take you to the hospital right now. Here's your window in the afternoon between 4 to 6, and somebody will come out and write your prescription or make sure your prescription's filled.
Okay.
And we also think, going to, back to the question about billing, we think there might be some ways to make that work with different private providers.
All right, the billing and the triage over the phone might work. I'd be real careful about the alternative modes of transportation, because I think Local 22 would be burning our phones up. So I wouldn't recommend that one.
It's tough. Again, I give a lot of credit to our dispatchers who are DC 33 members and what they have to do from a windowless basement on Spring Garden Street, and then listening to that, hanging up and doing it again.
Okay. Thanks, Commissioner. Sorry.
Yes,
Councilman Greenlee, sorry to take
Thank you,
so
Mr. President. First, on the whole EMS, the payment issue, and I'm sorry, you may have said this, I got distracted for a minute. I guess the concern is you don't want a person second-guessing calling 911, right? Because I know that's been the concern that was first brought up years ago when this charge first started being made. You don't want people second-guessing and saying, well, maybe that pain in the chest is just a little indigestion. And
Councilman, that's exactly right. We've had, over the years, we've had different campaigns about calling 911 appropriately, and my concern with those has always been that we might dissuade people from calling 911 or discourage them. We don't want anybody to be afraid to call 911. Where we do have opportunities, again, are with some of the care facilities, and we've actually seen, by working with them about when to call 911 appropriately or when to use a private transport provider or use their in-house resources, we've seen a huge benefit. And I have to give credit to Assistant Deputy Commissioner Crystal Yates, Assistant Deputy Commissioner for EMS, who's not here because she's out working. She's really spearheaded those efforts, and we've seen just huge decreases in demand from those facilities. So again, I think there's a sweet spot there, but please, if anybody feels anything, they should call 911.
right, exactly. Thank you. And the other issue on the smoke detectors, I know you folks do a great job. I was with you that one day in South Philly with the flyers handing out the smoke detectors. Do you have any numbers on how many you've actually given out, and any guess on the percentage of households, and I'm sure it's a kind of a guess, that have smoke detectors now?
Well, I think we've, so far this year, we've given out 2,259. And again, one of our federal grants was a grant for $1 million from FEMA to buy smoke alarms, and even more importantly, to get some adaptive smoke alarms, 4,000 adaptive smoke alarms, which are good for folks with hearing impairments or who are hard of hearing, or frankly, anybody who, you don't have to necessarily have a hearing impairment. It's just if you have a different way that you wake up, you can consider those as well. So we were very happy with that grant, and frankly, though, we have more smoke alarms now than we can give away. So we need folks to call 311, go talk to your neighbors, call 311, and that's our intake mechanism. And we promise that at some point, somebody from the fire department and one of our partners will be out to install smoke alarms. Now, that's just this year. Over the course of the program, and again, I have to give a lot of credit to all of my predecessors, in particular Commissioner Hairston, Ayers, Sawyer, for really, that's part of our DNA here in Philadelphia. That's not true in other places. So it's something that we're currently leveraging. It's a little bit of a competition among our frontline fire companies. And we've also, last year as a pilot, we stood up a 24/7, 365 fire prevention unit. So we can be right there when there's a fire in the neighborhood and start knocking on doors and either handing out literature and making appointments for smoke alarms. And we're looking at standing up with existing resources, a couple more of those units, because we find that we really need to be there right now with those smoke alarms. And it also gives us the opportunity to provide some care between the point of the fire and when the Red Cross arrives.
And am I right to assume, unfortunately, it's still a lot of the particularly the house fires are properties without the proper smoke detection section?
Yeah, you're right to assume that, Council. I mean, it's surprising given the commitment that this city has made. And again, it's not just the fire department. So many partners in the city council, everybody is talking about this. We're on TV all the time, yet we're still going to fatal fires where there are no smoke alarms. So we do hope that folks will help us get the word out.
And the last question related to that is there one particular cause of particularly household fires? Smoking, electrical, or is it still pretty much a mixture of things?
Those are two of the top causes.
Ones,
so smoking, electrical, cooking, heating, those typically are the top four. And they switch places, but those are the causes.
Right. Okay. All right, thank you. Thank you, Paul.
Thank you.
Thank you, Mr. President.
Thank you, Councilman. Chair recognizes Councilwoman Blackwell.
Thank you, Mr. President. Good afternoon. Thank you for all you do. I have a question. I can give you specifics or keep it general. We have someone who specifically is in English house, handicapped, spina bifida, and other conditions. Is it possible if she has a doctor, she's almost 45 years old, if she gets a letter from her doctor saying that she needs to go to Penn, would you all take her there? The issue is she's in English house. They take her to Lankenau. Then as soon as they take her to Lankenau, they can't deal with all her complicated conditions. And then her father fights to get her back to Penn. If she gets a letter from the doctors at Penn saying she has to come there and presents that, could your people then take her to Penn?
Councilwoman, we can. The short answer is it depends. We can get information from you offline and look into it some more. If somebody is in crisis, regardless of any underlying medical conditions, the statewide medical protocols essentially demand that we take them to the closest geographically medical facility. And that, again, that's the statewide EMS protocols, which don't always track with things we might consider common sense. The reason for that, the technical reason for that is if there's a crisis, and sort of by definition, if somebody calls 911 when they have these underlying medical conditions, it is a crisis. You want to get them to the closest appropriate facility. That said, we can get some information and have our medical director dialogue it, and we'll see it, because it does make sense to get to essentially your medical home base. And typically how that's done is with a third-party transport after you're seen in the emergency room at whatever the receiving facility is.
Yeah, and given her condition, it's always an emergency. And, not many I shouldn't call her youngster, she's not now. Not many people have lived this long who have some of the conditions that she has, and only Penn can take care of one of them. Lankenau can't treat it. So, what shall I do?
We'll get the information from you
Okay,
offline and
Okay.
And have our medical director look into it. The reality is it's a challenge for us to override the statewide medical protocols for a host of reasons that are really about patient care. But we can look into it, absolutely.
okay, thank you,
Yes, ma'am.
thank you.
Thank you, Councilwoman. Councilman Heenan?
Thank you, Chairman, Commissioner, and Command who are here with you today. Thank you for your testimony. I just think I remember when the mayor made the announcement, and you came in at town, and one of our our first conversation was the budget, right, and how closely you pay attention to numbers to better serve the department, which better serves the public, that keeps us safe, and learn from our experiences. And in a short time, I think I think what I said to you was to throw it all in, right? Ask for what you think the department needs, and go for it, because it's been severely, I think, underfunded for years. And here, I'm looking at you're reading your testimony, and what I've witnessed so far with your new command and how you're restructuring things. I just want to applaud you have a risk reduction here, but you took the risk in doing the right things for the right reasons without any kind of any kind of political interference or anything like that. So I want to thank you and your team for continuing to do the right thing. You effectively, with the mayor, stopped the brownouts. Is that correct?
Yes, sir.
Okay, and in your testimony here, you've put in and submitted for reopening and restoring some battalions. Is that correct? What does that mean when you're restoring battalions?
Well, essentially what it means is that we're reducing the span of control for managing administrative work, and more importantly, or equally important, to manage incidents in the field. Our span of control right now is approaching 8, so that's 8 direct reports for one supervisor. The optimal span of control for the type of work that we do is 3 to 5, and there's a national standard, the National Incident Management System, Incident Command System, that talks about that 3 to 5 as being where we need to be. So this helps get us closer. It takes us from 7, almost 8, to the high 6, almost 7. But that is the way we manage incidents. And again, a lot of folks, it's a misconception that a one-alarm fire is one fire engine, and on the second alarm you send 2. It is a typical first alarm assignment. The national standard first alarm assignment is 4 fire engines, 2 ladder trucks, 2 battalion chiefs, a medic unit, and actually the national standard requires a special service company of some kind, which we have in Rescue 1 and our 2 squad companies. So we're doing that more often, but they are often busy on other assignments as well. So it's depending on the type of incident, it's 16 to 24 people, and you can imagine why this is important. There are so many things that have to happen simultaneously. Fighting the fire, ventilating, doing search and rescue, which is always our top priority, commanding the incident, so the numbers add up fairly quickly.
They do add up fairly quick, and the response is been nothing but what I think City of Philadelphia deserves. So I'm glad we're headed in the direction where that we're going in right now. In the new budget, we are hiring, where I'm not sure if it was the last appropriations meeting, and bill we just passed, a new medical director. Is that correct?
It is. Right now we have a part-time contract medical director. So what's in the proposed budget is to have still a single full-time operational medical director. If you look at peer jurisdictions, or those that are much smaller than we are, they have multiple physicians and other types of medical professionals who help manage their system. So we'll be very happy to have a full-time operational medical director.
I think we'll be happy that you are happy to have a full-time medical position. So, it's interesting that the council president mentioned Uber, right? One for which I will not call for any kind of triage. I will call 911 and hope that that full-time medical director is working around the clock, and then I get a highly trained paramedic that comes to my rescue, or to anybody that we love here in the city of Philadelphia. And I say that because we were talking about triaging over the phone, or it just seems so. It may be innovative, but I like the approach that I'm working with your department on, and I see you have one of your deputy commissioners in the back, Gary Loesch. I broached the idea of having, since you have such a very good risk reduction program, all right, in fire prevention, adding a sort of low-level EMS training, CPR, AED, mental health, and your basic first aid community training for people in the public. And we are working with Philadelphia Fire Department and EMS diligently to encourage people of the community to what signs to look out for. What do you do after you call 911? Because that's always your first call. Call 911, and how to perform basic CPR, and or if they wanted the opportunity to get certified, people in the community would get certified. And I'm hoping that it really does catch on as far as the community's interest, and more members and people of the community who want to be involved. I mean, I've seen it firsthand, just even in our parks and recreation centers. I mean, we have these kids that are playing baseball, softball, cheerleading, and all these different variations of sporting and dancing, and you have a young child who has a hereditary, heart disease, all right, collapses, and somebody, comes out and responds, because they were trained, in partnership with the Philadelphia Fire Department and paramedics. I think that sends a good message. I think that really sends a great partnership, and I just want to thank you and your team for being willing and open to expand a little bit of your risk reduction when it comes to EMS and first aid. Even if it's for 2 minutes prior to the arrival of our city's finest. So I want to thank you for that, and look forward to getting fully staffed with our firefighters and paramedics. I'm really excited about the continuity, even though there may be a little cost to it with the scheduling. I think that all kind of dovetails and is in tandem with some of the things that you are looking to accomplish, and the direction the department's going. So I think it's well worth the investment, and looking forward to training 209 more cadets and paramedics. So thank you.
Thank you, Councilman. And I should say all credit goes to the team. And you mentioned Deputy Commissioner Gary Loesch. We have Assistant Deputy Commissioner Natasha Now. Again, a number of other deputies and assistant deputies who are back at the office working, and most importantly, all the men and women who are out working in the street 24/7, 365. That's the biggest thing for me here coming to Philadelphia, is that I think I can appreciate what our folks do and have been doing for so long in a different way. And I can tell you, it's just, when I use words like incredible and awesome, I don't mean those in a hyperbolic way. It really is true about what those folks are doing out in the street every day. Thank you.
Thank you, Councilman. Councilman Dom.
Thank you, Mr. Chairman. A couple of follow-up questions. Between today and the next 5 years, Commissioner, what do you think are your 3 biggest challenges?
We sort of anticipated that question, Councilman. Look, I hate to sound crass, but this is a budget hearing. I mean, it's essentially resources. I mean, resources, resources, and resources, and that's staffing, training, equipment, vehicles, our facilities, and there's just, that is kind of for everything that we need to do from a mission standpoint, everything costs money, and again, you heard it during my great colleague, the police commissioner's testimony. Training for our workforce, and we're not as large as they are, but still to take, depending on whether we're training everybody or our uniform force, 2,500 to 2,800 people, there's no way to do that while they're at work because they're so busy. Our medics don't even get a chance to use the bathroom sometimes during a 12-hour shift, or eat, or just take care of basic needs. Our firefighters, remember, a fire incident is not you go spray some water on it and then go back. It's an hours-long event. So as busy as we are, there's no time to do training on duty, so we have to do it off duty, and that's overtime. And the only way to do that is with overtime. Now, we are also exploring train-the-trainer models. We're hoping to leverage technology with our great partners from OIT. So I think there are opportunities there. At the end of the day, any of those things, addressing the opportunities in the NIOSH report, from the tragic loss of Lieutenant Joyce Craig. Again, we're still doing the after-action review and the investigations on Matt Latorno's tragic loss. These are all things, again, we've been fortunate that federal grants, a federal grant right now is letting us do fireground survival training, which is critically needed for our entire workforce to the tune of about $3.5 million. Some of that is a city match. Actually, on top of that is a $500,000 city match. But that's what it costs to train our entire workforce. And we have so many different topics that we need to do, plus continuing to, and again, thanks to council support, the mayor, our great partners with Fleet, Public Property, we're on a great path, and this proposed budget really kind of kicks the accelerator. We still have a lot of latent needs that go back a long time. And again, I think you heard the budget director articulate that very well, and the chief of staff too. I mean, so I think we're on going in the right direction. It's going to take some time.
Does the fire department have their own CFO?
Well, we essentially have our chief of staff, Tara Moore, of course, has worked in a number of different agencies and is absolutely, I would say, a finance expert. Our assistant deputy commissioner for finance administration, Natasha, now has worked as actually a city manager and has done a lot of finance. She was a finance officer, and then Deputy Commissioner Jesse Wilson, who you know from other jobs, has done incredible work as the Finance and Administration Deputy Commissioner, and kind of getting things. And again, it's a partnership with budget, but I think we're in a place, and credit to Tara and Natasha and Jesse for getting our budget sort of. You can see if you look at it last year, the allocations are different in terms of where they are organizationally, because that actually reflects how we're organized as opposed to what it was before. And again, I think it's a great partnership with budget, and we're looking to continue to leverage that. So that was a long way of saying we have a few folks who I think we consider CFOs.
Okay, thank you. Thank you for your testimony today. Thank you. Thank you, Mr. Chairman.
Thank you, Councilman. And no further questions. Again, as I think everyone said,
Mr. Fourth District.
The chair recognizes Councilman Jones.
I would be remiss if I didn't cite that my commissioner lives in the 4th Councilmatic District, and we are proud to have him as a resident.
You never miss a chance, sir.
Thank you,
Okay.
Mr. Chair.
Right. Well, as an at-large council member, I'm glad he lives in the city of Philadelphia. How about that?
Absolutely, absolutely. And there might be some updates on that, Councilman, but I do love the 4th District. Thank you. I love the 4th District. I want to spread it around. Spread the love.
Fairmount's a great neighborhood, Commissioner. Yeah.
But I do appreciate that.
But again, thank you for all your team does, and as you said, the men and women out there every day, you're a credit to the city. Thank you, sir. Thank you all.
Thank you all. Thanks for the support.